This is Stephanie Kirshner. I'm going to pass control over to Vatsala after we go through just a couple of housekeeping items around using GoToWebinar. On the left of your screen is your GoToWebinar viewer, and you can see the presentation and a control panel where you can select your audio mode. There will be time at the end for questions and answers. To ask a question, we're going to ask this time that you submit it by typing it in to the questions box towards the bottom of the GoToWebinar control panel, just because it was a little hard to hear people last time when we did them by audio. Just as a reminder, the webinar is being recorded and will be posted to the YouTube channel and the Colorado STEM website. And I was supposed to advance the slides as we were doing this, so you can see where the questions box is to type in your questions. And these are the links to the websites, which I'm sure you're familiar with at this point, where the webinar will be posted. So I'm going to pass it over to Vatsala, and I'll get your slideshow started, and you can go ahead.
Thank you, Stephanie. I'm going to actually ask Catherine Blair from the Governor's Office to kick us off. Stephanie, if you would go ahead and go to the next slide, please.
Great, thanks, Vatsala. This is Catherine Blair, formerly Catherine Blair, transitioning to Catherine Mulready, recently back from vacation. And really just want to take a moment to thank everyone for the work that you've already put into this project, whether it's been over the past 2 years and particularly the past month or so as we've really ramped up efforts. And for the coming 19 days, which is the number of days we have left to really finalize everything before we turn this over to the feds. I recognize how much work this is for so many people on the phone and others who aren't able to be here today. Hopefully they're all on vacation. But also, you know, as we approach really the final stretch, the turnaround times are going to get tight. And hopefully we are able to respond to your concerns and answer the questions that you have today or maybe down the road as things arise. But really thank you for putting your brain power behind this and taking your summer to spend it on STEM. So I'm going to turn it back over to Vatsala, who's going to walk us through some of the procedural stuff, but just thank you from us.
Thank you, Catherine. So we're going to really devote this webinar primarily to answering your questions, but we did want to kind of cover a little bit of ground in terms of informing you about the progress that we've made to date, and also to tell you a little bit about the stakeholder process and some of the things we've heard. Next slide, please. Stephanie, thank you. You know, I think that all of you that are on this call today probably are already aware of this, but you know, really the building blocks for SIM have been in play in Colorado for a number of years through the hard work and commitment of many, many, many people who have been working on a variety of initiatives, including the 208 Commission, prior work on the SIM plan, the public health folks who have been working on local health improvement plans, and the governor's office and the governor who really made a commitment to health through their state of health. So we're really building on and not trying to create any kind of new infrastructure per se outside of what we need at a basic level to move this work forward, but this is very much built on all the work that's been done. Next slide, please. So what are our visions and goals? To create a coordinated, accountable system of care that gives Coloradans access to integrated primary care and behavioral health in whichever setting counts as the patient's medical home. To leverage the power of our public health system to achieve broader population health goals and support delivery of care. to use outcomes-based payments to enable this transformation and to engage individuals in their care. Next slide, please. So the core SIM management team has representatives from the Governor's Office, the Colorado Department of Healthcare Policy and Financing, the Colorado Department of Human Services, the Colorado Department of Public Health and Environment, the Colorado Health Institute, the University of Colorado School of Medicine, and the Center for Improving Value in Healthcare. And I just want to do a shout out to all of those on the management team who've been working around the clock over the last 5 weeks or so to get us to where we are today. So thank you. Next slide, please. So where are we at as of today? We have submitted our letter of intent, which was a very kind of procedural thing that needs to happen in order for them to know that we're interested in submitting the full proposal. That LOI is posted on the website if you're interested in looking at it. We received a great deal of stakeholder input through our initial feedback request out to you, and that we received on the 16th of this month. And that stakeholder input was taken into account by the SIM management team as it has been working on developing both the narrative and the budgetary components of the proposal. We've been sending out weekly updates to those that are on the distribution list. I just want to make a quick note to those that want to be on the distribution list but are not on there. There is a mechanism on our website to sign up. And we do send those out through Constant Contact. So if for any reason you're on the distribution list and you are not receiving it, you just may want to check into the Constant Contact on your end to make sure that you're able to receive those emails. We have a draft proposal out. It went out last Friday, and we are seeking your comments and input through our website. And the deadline for that is Independence Day, the 4th of July. And then between then and the 21st, which is the deadline for submission, we will be working internally to get clearance on the final proposal and submit it to the federal government. So next slide, please. So you might be wondering what are some of the highlights and themes that we've heard through our initial stakeholder input process, and we just wanted to highlight a few of those. We heard that we need a stronger pediatric focus in the proposal, that we need to have a stronger consumer voice, that we need to build upon rather than creating new structures as much as possible. And this is something that the SIM management team is very committed to doing. And that there should be a focus on behavioral health services across different acuity levels, that we should be looking at the needs of patients across the continuum. And that having a strong public health voice, both the state and the local level, is essential to us meeting the goals that we have on this project. We've taken all of this and other input that we've received very much to heart, and are working to try to integrate where you all identified weaknesses in our proposal. We are working on strengthening that and making sure that we take note of some of the themes that we're hearing from our community. Next slide, please. So what we need from you are letters of attestation, and those letters can be sent to Sarah Ritchie, and the address is on the slide, by July 7th. And if you have questions about what can or would optimally be included in those letters of attestation, please don't hesitate to be in touch with me. At the end of this slideshow, there is an email address that you can send comments or questions to, and I'll be happy to turn those around as quickly as possible. So with that, we've got a number of members of our SIM management team either on the line or with us, and so we'd like to open it up for questions, and I will ask my colleagues to chime in as questions come up. So I think Stephanie has requested that you type your questions into the box on the right side of the screen. So if you all would start doing that, and we will take them in the order we receive them.
Vatsala, would you like me to read the questions?
Yes.
Okay, so the first question is the letter of attestation the same as letters of support?
Yes, it is the same thing.
And this is Catherine, can I just add to that? So the CMS calls them letters of attestation because they are more specific than traditional letters of support that we're all used to writing for each other no matter what we're applying for something, right? The difference between what what all of us would normally do for one another and the letter of attestation is that it really needs to focus on the specific things that you or your organization is going to do to contribute to the SIM proposal. So Vatsala and her team have developed some kind of examples that apply to different categories of folks. So for example, what providers might say is different from what payers might say is different from what the foundations might say. And so please feel free to reach out to her if you're having a hard time thinking of what specifics to put in your letter. But generally speaking, certainly a statement that you're behind the work and that your organization is willing to do, say, 3 specific things that tie into the work. And we're more than happy to have conversations with you if you're not sure exactly what those might be.
Stephanie, you want to?
The next question was about a practice is still collecting physician practice clinic letters of support and wondering if it's okay if those are submitted after July 7th. They're asking if a July 15th date would be acceptable.
The absolute drop deadline for letters is July 14th, but there's no, I don't have any wiggle room past the 14th. So yes, there is a little bit of room there to extend the deadline past the 7th. The earlier, the better.
And while we're on letters, this is one of the topsy-turvy pieces of the application. In 99% of the components of the application, we have a page limit. We have really strict requirements of what we're trying to achieve. With letters of attestation, quantity is the thing. And so if you're part of a collaborative and you want to submit a letter on the part of the collaborative and then on each of the organizations within the collaborative, that's great. It's a lot more work for the staff compiling it, but CMS kind of counts them and views them as really a collective thing, but number matters.
And please, when those are ready to be sent, please put them in PDF and send them to Sarah Ritchie or myself. I'm also compiling them. I've been receiving some as well. So, so yeah, a PDF would be great. Thank you.
Okay, the next question is, this administration has problems getting funds released on deadline dates. Are there contingency plans if the funding is delayed?
Stephanie, could you just repeat that one more time, please?
So I'm just reading verbatim. So this administration has problems getting funds released on the deadline dates. Are there contingency plans if the funding is delayed?
Yeah, so this is Catherine. I can talk a little bit kind of about the process and why. I hope that when you say this administration, you mean the Obama and not the Hickenlooper administration. But so a little bit about the process after we submit our application. Typically what happens is that our kind of expert grant staff enter into negotiations with the feds over certain particulars of the grant, whether that be the budget or elements they do or don't like. And so the current timeline we're working with from the feds is that funds will be in hand by January 1st, 2015. I would say that our contingency plans around if that's delayed are going to be based on how delayed it is. So, for example, the HHS, at least, and CMS in the SIM context, hasn't been so bad of releasing funds once they've released the FOA and once they've received nominations. There may be a month or two delayed, in which case we'll just push deadlines back a month or two. I think where there has been significant delays is in releasing the FOA. So at least we're past that barrier, if you will. But we will develop contingency plans if we hit any significant delays. If it's a month or two, we'll just shift things a little bit.
Next question, Stephanie.
Okay, so the next question is, HRSA, NIH, and SAMHSA use some form of secured video conferencing. Because of the sophistication of this administration with internet technology, how is that being addressed in the IT efforts?
Can you repeat the first part of that question? I believe that you're asking about some of the policy and privacy concerns around sharing behavioral health information electronically and across video.
I would assume that that is correct. The question's a bit fragmented, but I believe that's what the question is being asked.
So that's also the health information technology section is broken down into different pieces. The first part is for technical assistance. The second is into a centralized clinical and data infrastructure hub, and also a telehealth component. Along all of those is always going to be a privacy and security component that will be developed with the governance structure as well as the policy levers that have been identified. So there are already some existing mechanisms in place to identify the policies and update those policies. So while it might not be called out specifically into the narrative, we can take that as feedback to determine where and make sure that the policy for sharing that information is identified and one of the priorities. Also, for folks on the phone, this is Kate Kiefer, the State Health Information Technology Coordinator. So to give that reference. So absolutely, that's one of the priorities, and if it's not specifically identified, we'll take that recommendation to make sure we address how that's going to be addressed.
So the next question is, do you have a draft LOA for us to follow where we can then add our specifics? And then the second question is asking if these letters should go directly to Sarah Ritchie.
Yes, Sarah Ritchie is responsible for collecting all the letters of attestation, and if this particular person is interested in a template letter, they should get in touch with me. This is Vatsala, and I'd be happy to provide them with a template letter that they can edit on their end.
Okay, the next question is, can you elaborate on the statement in the draft that a child mental health coordinator would be on board to work with CDHS, the system, and public health entities? Has this person been identified? What kinds of activities would be expected of this position, et cetera?
Thanks. This is Catherine. So I'm going to take it at a really high level of kind of where the structure is around that. And if I don't answer the asker's question, they can certainly shoot us an email, and I can get them more detail. But if you're familiar with how CDHS has moved, particularly in the world of early childhood mental health, they have recently hired a person, Jordana Ash, who is in CDHS, to oversee early childhood mental health. And then in coordination with Jordana, there will be 17 early childhood mental health specialists that are aligned with the Colorado Mental Health Centers all across the state. And they have very, very specific functions of trying to essentially be care coordinators help families work through physical and behavioral health needs and kind of liaise back and forth. The purpose of the position that's written into SIM around that is really to also be a structural infrastructure level liaison kind of between public health and community support systems all across the state, but particularly at the state level, to make sure those all of those initiatives sound coordinated. So if you have additional questions, please feel free to follow up with me.
That was the last question submitted.
Are there any other questions?
I think we're set. I didn't, we kind of asked that we limit to submitting the questions by typing them into the chat box. So we could hold for a moment to see if there's another, but at this point, that's it.
Yeah, why don't we hold just for a few minutes?
Okay.
And while you're doing that, again, if questions come up as you continue to review the draft and after the call is finished, please feel free to send them to us via email. We'll do our best to get you a timely response. Just to reiterate, the letters of attestation are really key. Your feedback is really key. I know it's due on Friday, which is a holiday, so if you have the opportunity to submit it before you leave the office today or tomorrow, that would be great. And that input will be taken very seriously as the management team kind of consolidates all the feedback and makes changes to the current draft that we have. Positive and negative feedback are both totally valuable, and so whatever time you have to commit to this, again, we thank you and I really appreciate your brain power.
There are a couple more questions that have come in. One is asking me to go back a slide for Sarah's email, and I will do that. But related to the attestation letters, who should they be addressed to?
They should be addressed to the governor.
Okay, and then this next question is, in the draft proposal, it states that the goal to help as many practices as possible move to integration by the end of the grant period. Is this realistic and feasible? Does it discredit, oh sorry, that my screen just moved. I'm sorry, hang on one second. The questions are coming in fast and furious and my screen just moved. Does it discredit other models that can be just as effective, particularly in rural areas and for smaller practices?
Sorry, we were having, oh, Edie is willing, we were having conversations about who was here for that conversation. I don't know if we can unmute Edie, but Edie is planning to answer that question or would like to answer that question.
Stephanie, Edie's not here with us, so is there a way to unmute her line?
I can work on it. Do you want me to go to the next question while I do that?
Sure.
Let's circle back. Thank you.
Oh, we have Edie.
Oh, am I unmuted now?
Yes.
Fabulous. Great. Thank you so much. This is Edie Sun. I'm a member of the management team that's been working on the delivery and payment transformation section. And our goal, as you say, is to move as many practices as possible to the goal of complete integration by the end of the cooperative agreement period, with the understanding that there are many practices that will never be able to achieve that goal, either by virtue of their geographic location or their size or other limiting factors. And so we absolutely want to support every practice in integrating to the extent that is practicable for them. We want to support models like telehealth and telepsychiatry and enhanced coordination in those fashions for practices that aren't capable of co-location and true integration.
Okay. The next question is, the budget does not reflect a regional or statewide philosophy.
Wait, hold on just a second. Can we re-mute Edie? We're getting some feedback. There we go.
The budget does not reflect a regional or statewide philosophy. This may not be intended, but the way it is articulated at this point, it misses a reflection of statewide effort. Can this be changed?
You know, I think we actually maybe need the question presenter to provide us a bit more detailed feedback around their perception of the budget. I think from the management team's perspective, it does reflect both the statewide kind of infrastructure and coordination function, as well as direct support to more regional and community-based efforts, which is really the philosophy that we've tried to apply throughout SIM. So I don't know that we'll be able to kind of answer those concerns, but I do on the call, but I do want to be sure that we address them, and to the extent that we might need to address them very specifically in the budget narrative. So if you could submit your concerns in a feedback form on the website or email VOTSLA, that would be really, really helpful, and we can follow up with that.
The next question is back to the letters of attestation and asking if the letters should be addressed to the governor again. It's asking specifically it should not be addressed to Gabriel Na, and I'm sorry if I just mispronounced the last name. What address for the governor?
Okay, so there are two options. One, you can address it to the governor, and this is the people who don't take notes option, right, like me. Governor John Hickenlooper, State Capitol, Denver, Colorado, 80203. Or Gabriel Na, you may see in some of the templates and in some of the other attestation letters. He is our HHS person that we'll end up sending all the letters to. His title and address is really complicated, so I won't even bother to run through it. So if you have seen Gabriel Na and you want to just use that, fine. If it's easier to do Governor, State Capitol, Denver, awesome.
Okay, the next question. There is some placeholder language in the draft proposal specifically about quality metrics for kids. Are you planning to leave placeholder language in the final draft, or are you planning to determine pediatric metrics before finalizing the proposal?
So this is VOTSLA. Our commitment is to have pediatric quality measures in our final measure set. The first year of the 4-year endeavor is our ramp-up year, and we will work in conjunction with the pediatric community to finalize those measures. We have a set that a universe of possible measures that we've been exploring in conjunction with some of our colleagues in the pediatric community, and we'd like to hone down on those in 2015. So for the purposes of the submission, we will indicate that is something we will absolutely do, but we haven't fixed on those measures as of the time of submission of the FOA.
So the next question, doesn't CMMI want to fund a test of redesigned practices and redesign payment? If so, where in the goal statements is it made clear that Colorado will do so?
So the whole project is the model test, if you will. And the 2 years of work that we've been doing kind of have helped establish what that test will look like. So when CMS talks about the test, they're really talking about a new model for delivery. So in particular, if you look at the actuarial work that demonstrates kind of the budgetary returns and the payment reform components of that, and how we're transforming the system by integrating behavioral health, that really is the test that we're talking about.
Okay. As a follow-up to another recent question, how do you intend to expand the implementation of integrated practices beyond the initial 73 practices reflected in the draft proposal? This effort at this point seems to reflect the Denver metro area, which is understandable. However, the proposal could be strengthened by reflecting the integration efforts underway outside Denver that can be scaffolded through this funding, building upon new models now in operation.
So the 73 practices that the ASCR is referring to are likely the practices currently participating in the Comprehensive Primary Care Initiative, or CPCI. You know, our objective over the period of the grant is to have roughly 400 practices participate, and there is a very clearly detailed kind of ramp-up period, ramp-up procedure really behind that. So it will certainly include CPCI practices. One of the reasons we focused on them is because they are a little bit ahead of the curve in some of this integration work. I don't want to say that the non-CPCI practices aren't doing this, but CPCI is one of the federal initiatives that CMS is really most interested in building from, and so we're hoping to start with them. Now, that said, the CPCI practices as a whole or as individuals may or may not be part of the first cohort, right? Our first cohort will be roughly 100 practices. That may include all of CPCI, some of CPCI, plus other practices to comprise it. Pediatric practices will be in there, other practices that are really demonstrating an interest in and capacity to really take integration to the next level in the first year.
And just to add to that, as far as the rural piece, we're very much committed to having these practices through, not just in Metro Denver, but throughout the state. Stephanie, are there any other questions?
I'm sorry. What are the mental health and mental illness outcome measures, and how will costs of medications be monitored and reported?
Ben Miller, I don't know if you're on the line right now, but it would be.
I'm happy to take that. Great question and really good point. So because the model that's being tested here is looking at the impact of behavioral health and medical conditions, the measures that are initially proposed are those that are most prevalent in some of our primary care settings. So the quality measures that we're currently looking at, which you see in the draft as proposed measures, have to do with depression, anxiety, and substance use. Now, those measures in and of themselves are really insufficient because we're looking at them as being combined or connected to the other medical measures as proposed. With regard to the medication cost, this is obviously a really important point and will be carefully vetted and explained through the actuarial analysis that's done through our partners performing that particular piece.
Thank you.
The next question is, who and how will people be trained in integrated care?
Ben.
Great question again. This has been, once again, it's important to note that when we start to bridge the gap between behavioral and medical, or mental and physical, that there are inherent cultural issues that require providers on both ends of the continuum to really understand what it's like to work on a team. Training and education is central to developing the workforce that we really want for the state of Colorado to deliver more integrated care. As I think you've seen reflected in the draft, there is some discussion around workforce. However, I think this question really does highlight how we can better articulate specific training models that exist out there for providers that are coming up into the system from our medical schools, from our graduate programs, as well as providers that are currently out there delivering care. How can we offer training opportunities or exercises where they connect to other practices that they can learn from? So a great question, and one that I think that we could easily explain a little bit more clearly with the proposal.
The next question is, the draft emphasizes strengthening public health as an enterprise. Is this what CMMI aims to fund?
Yeah, this is Catherine. So one of the biggest differences between round 1 of SIM and round 2 of SIM has really been CMS coordinating better with CDC. And as a result, they have put kind of population health writ large, right, as a core component of SIM and making sure that we're taking a population health approach. I think you know, what that means for Colorado is that both our statewide public health infrastructure and our local public health infrastructure are going to be key partners in this, but I don't think that that's exclusive to just kind of quote-unquote public health systems. I think that also includes a lot of departments of human services and other community wraparound supports, if you will, that can really focus on serving individuals, but with a population level plan in place.
Okay, the next question is there a brief description of the uses and persons eligible for funds, such as transformation, bidirectional health homes, and health transformation?
This is Vatsala. So our plan is that we will go through some sort of a grant application process for that, and it is something that we need to strengthen in our narrative to describe that piece, but there would be a process by which practices and other entities could apply for funds to support their work, you know, related to the SIM project. So, yeah, so that's hopefully that answers the question.
What are the plans to increase the consumer voice or dedicate resources for direct engagement of patients and communities in the proposal?
This is Vatsala. So one thing is that we are working on ensuring that there is a greater thread throughout the document as it relates to consumers. It has always been our intention and commitment to ensure that there is a consumer voice in this project moving forward. And so, and did you want to add anything else on that?
Well, also from a health information technology infrastructure perspective, much of the data infrastructure and the data quality, the consolidated reporting to a centralized hub, is also setting the framework or the groundwork for additional consumer engagement through technology means. While that wasn't specifically called out in the narrative and not identified as funding, but this foundation can be expanded to support patient-reported information, quality information. So this is just adding another more infrastructure to help support more consumer engagement through technology as well.
Would it be a good idea to reflect Colorado formal education programs that are already providing training in integrated healthcare in the proposal?
Yes, and if the person who asked that question would like to write 3 to 4 sentences about that and send them to me, Catherine Blair, by the end of the day today, that would be really, really helpful. Thank you.
Will there be a grant opportunity for HIT needs throughout the state?
There is not a grant opportunity carved out into the narrative or the budget. However, the services that will be there will be services for health information technology, technical assistance that will partner with the clinical transformation services. So for the clinical assistance of the integrated care models, then there will be technical assistance for EHR configuration and data quality support services, as well as extraction and consolidated reporting. So there will be technical assistance resources available statewide through partnerships and that partner with clinical practice transformation.
If a practice partners with a community mental health center to bring in a behavioral health professional, will the practice get the money for that, or will the CMHC get the money for that?
That's a really good and interesting question. I think, you know, the threshold piece that I want to infuse before actually answering the question is that part of the goal of SIM is to transform the way we're doing payment, right? And that applies really in the kind of physical health, traditional healthcare mode, more so than a lot of the managed care ways that we currently run with with CMHCs. So I don't want to say that it's going to be like, here's a pot of money, go hire someone, right? But I think this is a really big question that we will need to detail in the ramp-up phase. But with the ultimate goal of transforming payment as the underlying premise behind how we roll out those specifics. So totally dodging your question, but not because we don't have an answer, but because we intentionally want to be really strategic about how we do that in the context of payment reform and with partners at the table. It may differ between one CMHC and physical health partner and another.
The evidence-based data indicates that most depression, anxiety, etc. interventions should be therapy under the ACA guidelines. How is that being addressed?
Ben Miller, would you like to take that one?
Sure. It's a great point to bring up the importance of evidence, and I think that just because we're talking about new ways of delivering care, we can't turn a blind eye to some of the evidence-based recommendations that exist out there for treating certain conditions. And so this is a great point that reminds us of how important it is to look back into the literature, look back into some of the guidelines, and see how we can leverage those as our practices transform. Central to this, though, is the recognition that in order to adopt new guidelines or new ways of delivering care, we also have to understand that practices have to change fundamentally how they deliver that care. So there are inherent workflow issues here. There are challenges with looking at engaging new members of the team consistent with the evidence. All of these things are really critical, and I appreciate the person asking the question because it is something that we do want to highlight, that evidence is important here.
Vatsala, that was the last question.
Should we wait just a few more minutes in case there are any additional ones before we wrap up?
Sure.
Stephanie, have you gotten any more?
No, not yet. Oh, wait, I just did. I just got one. Will we get a Q&A summary from this?
This entire webinar is being recorded and will be posted on the Colorado SIM website.
And again, if you have additional questions once we wrap up, please feel free to email them to us, or even more preferably, throw them into a feedback form, and then the management team will be able to take a look at that collectively with all the other pieces of feedback, and we'll try to get back to you as soon as we possibly can as we kind of flesh out the final version of the proposal.
I think maybe people have exhausted themselves. I don't see any more questions coming in.
Okay, well, our heartfelt thanks to all of you for your interest and your commitment to this work. It can't happen without all of us working together, and all of us on the SIM management team are really grateful for your questions, your concerns, your comments, and your pats on the back when they're merited and appropriate. So thank you, and please don't hesitate to be in touch either with myself or anyone else on the SIM management team if you have questions between now and the submission, and we'll look forward to staying in touch with all of you after the submission has been completed and we kind of enter our next phase of work. So thank you very much.